Our next panelist is Dr. Susan Waisbren from Boston. Susan is an associate professor of psychology in the Department of Psychiatry at the Harvard Medical School and on the associate scientific staff in medicine and division of genetics at Children's Hospital in Boston. She's the founding director of the New England Consortium of Metabolic Programs. She's also on the board of the New England Connection and for PKU and allied disorders, and a member of numerous professional organizations. She recently organized the Genetics and Metabolism Psychology Network to bring together psychologists interested in PKU and other metabolic and genetic disorders to help better describe the psychological aspect and development educational tools for families and teachers. I attended Susan's workshop yesterday and was sort of blown away with all the things that are going on, and particularly the interaction between families and even children in that workshop and sharing some of their experiences in handling the PKU situation. Susan is an integral part of Dr. Harvey Levy's metabolic disorders team in Boston. In fact, Harvey told me when I told him I was going to be pleased to meet Susan here in Dallas, and he indicated that she's the most knowledgeable clinical psychologist in the world on metabolic and genetic disorders, and they couldn't do without her. So, Susan.
I feel like Dr. Scriven should sit down before I start. But anyways, today I'll be talking about the neurocognitive functioning in PKU. And in thinking about this, I realized that the story of PKU is really the book of Genesis in the world of metabolic disorders. It was the first metabolic disorder that was recognized. It was the first treated genetic disorder. And it was the first disorder to be mandated for newborn screening. So it really was the beginning. The prophets, actually, have been the parents who helped in all of these advances. It was parents who pushed the first doctors to say, "What's wrong with my child?" And they found it out. It was the parents who really said, there's got to be a treatment for this. And it was the parents of two children with intellectual disabilities, Dr. McCready and Dr. Guthrie, who pushed for newborn screening. So really, those have been our prophets and our heroes. The other similarity that came to mind is that in PKU, there is the potential for a, quote, perfect outcome. That is, perfect in the way before the fall of Adam and Eve. It would be perfect in PKU if everything else was perfect. That means that a child never had an illness that might raise the blood phenylalanine levels. A child never spit up their formula. There was never a teacher who gave a piece of birthday cake. There was never any life event that caused stress, which would cause other reasons for the blood phenylalanine level to rise. So, yeah, there's the potential for a perfect outcome if everything else is perfect. So what I'm going to do today is really talk about some things that might be a little scary, some of the things that aren't perfect about PKU. But if we can think about it in terms of the lessons of the book of Genesis, which is really the whole story of our humanity, of that we're not perfect beings. But by going through those stories, we learn about human failings or human idiosyncrasies or human interactions. But by studying that, and same by studying what happens in PKU that might not be perfect, we can do something about it. It gives us sort of tools for dealing with some of these things. So that's how I'd like you to take what I'm talking about today. So let's get started. So there's 3 points. The first is that even treated children and adults experience neuropsychological effects in PKU. The second key point is that psychological assessments are important. You know, if you face your challenges, you can do something about them. If you hide your head in the sand, it's really hard to do that. And third, that there are strategies for improving functioning in PKU. If you recognize what's going on, you can do something about it. It's also important to remember that children with PKU are basically normal. So we're not talking about terrible things. We're talking about human things. So the first key point is even treated children and adults experience learning difficulties and other neuropsychological effects. And what are they? The main neurocognitive effects, and these are especially if blood Phe is not consistently in the target range. Reductions in executive functioning, and I'll be talking a little more about that. But basically, executive functioning are the higher level analytical skills, and it's related to memory, It's related to being able to plan, certainly attention, and organization. Executive functions is sort of the new ADHD. You won't find children diagnosed with ADHD as often now, or if they are, it will be and executive functions, because it all kind of goes together. Second, and equally important, I think, is mental processing speed. How quickly can individuals with PKU process information that comes into them? So they hear something, how quickly can they organize it and then respond to it? And then the last, the impact on behavior and mood. So the first thing is adherence to treatment, and Ronnie spoke about this also in similar studies. But really by the age of 15 to 19, 80% of individuals with PKU are not within the recommended range. Don't blame the victim, okay? I'm going to talk about what it is about the neurocognitive aspects that might cause this. It's not willpower alone, okay? There's a lot of other stuff going on. And why are the problems? The first one is the dopamine hypothesis. And Ronnie referred to dopamine, and you've been hearing about it. Here's the pathway. Phenylalanine eventually gets into dopamine. But the way I like to think about it is that dopamine is very important in the prefrontal cortex. That's the kind of right underneath your forehead is the prefrontal cortex, okay? And that's been shown by Adele Diamond initially and many other studies to be an area of the brain that's particularly sensitive to even modest reductions in dopamine. So if in PKU we have modest reductions in dopamine, which we think we do, we're likely to have effects in the prefrontal cortex, which is where all that higher level organization, planning, attention takes place. So that's the first point. And this shows kind of what I was saying. The other thing to remember, it's not all about dopamine. There's also perturbations or changes in other neurotransmitters in the brain. And what are neurotransmitters? An easy way to think about it is that you have senses. You hear things, you smell things, you touch things, all that. That occurs more in the back part of the brain, okay? That's not a higher level. That's sensory stuff. The neurotransmitters take that information, and they're the messengers that bring it to the prefrontal cortex, all right? So that's why you need your neurotransmitters, because that's what is able to do all that processing for you, okay? And it affects executive functioning. And there have been studies on all kinds of ages of populations showing that executive functions are reduced in individuals with PKU through the ages. They even talk about it in babies, where it's a little far-fetched, but in a sense it's the baby that keeps sticking his finger in the electric light socket, no matter how many times you say no. That's a little bit of pre-executive. And it affects executive functioning. And there have been studies on all kinds of ages of populations showing that executive functions are reduced in individuals with PKU through the ages. They even talk about it in babies, where it's a little far-fetched, but in a sense it's the baby that keeps sticking his finger in the electric light socket, no matter how many times you say no. That's a little bit of pre-executive functioning. In children 7 to 14, we see it mostly in attention and impulse control. And this is very relevant in PKU, and I'll show you this later, but around executive functions really solidify around age 10, 11. That's when, and you'll notice in school, that's when children are expected to do comprehension tasks, not just rote learning. It's when math gets a little more complicated. You have to get math concepts. My experience is most children with PKU cook along just fine till about 4th grade, and that's when some of the learning issues and challenges occur. And I think it's because of the executive functioning aspects. The other interesting point is around age 16, in late adolescence, executive functions in the normal population dip. And they get back to about the level of maybe, your 6 or 7-year-old. And those of you who have teenagers and younger children know the 10-year-old that turns and says, "Mom, why is Johnny acting like that?" about the 16-year-old. Well, that's really normal, okay? That's what happens, and can again explain some of this lack of adherence at that age when you see it. So don't blame the victim. It's not the person's fault particularly, and if we recognize it, we might put in some strategies. And then in adulthood, we see it also in comprehension, organization, planning, And adults who work say, you know, I'm not in school anymore, but I'm having trouble at work just keeping things organized. If everything is just the same every day, I do fine, but when I have to change my schedule or go from one department to another, I have difficulties. That's executive functioning. And in general, if executive functions aren't working as well, IQ will not look as good either, because you need some of these analytic skills in IQ. What we see, these are some, this is a PKU compared to peers. It's a small study, but all the studies pretty much show this. IQ is normal, okay? A normal IQ is 100. Our patients, basically, that's where they fall, around 100. Within 85 to 115 is the normal range. So our patients generally are functioning well within the normal range for IQ, but the peers are a little higher. And similarly with siblings, the IQ will come out a little lower. If we look at just certain aspects of the IQ test, it's actually the same. Vocabulary, which is considered sort of the core intelligence factor, is usually just fine in PKU. That's not where we'll see problems. We'll see problems that will lower the IQ just that little bit in some of the processing questions. Let's see. All right, so I'm going to just quickly go through a number of studies that show what kinds of executive functioning deficits we have. And we show this slide to reiterate the point that it's a brain effect, that in PKU, the percent of children that have executive functioning deficits was about 21%, I think, is that what it is? Yeah. Compared to hydrocephalus. And there's not really any other relation except that it's a brain thing. It's not something else. And in terms of attention problems, 26% in one study were on medications for attention deficit disorder, compared to 7% in diabetes, another chronic illness, compared to about 4 or 5% in the general population. I will add a caveat here. I don't believe in attention deficit medications for PKU unless the blood level is low. My experience is you can knock out a kid and get them calm, maybe, but they're not going to learn any better with the Ritalin and those medications because it's not addressing the real problem, and it's not getting into the brain probably because the blood levels are high. There's been no study on that, but it's certainly been clinical experience, and I've talked to many other people who've had that same experience. So I wouldn't go that route. I would go the route of let's get the blood level lower and then see if we still need it. Working memory. That's how much memory you can keep in your head. We test it by being able to say digits backwards. So it's they can do pretty well on just repeating numbers, though phone numbers are a little hard. We found that yesterday on our test I was doing in some of the adults. But doing numbers, taking numbers forwards and then being able to remember them and say them backwards is a really good way of looking at working memory. That's an area of difficulty, executive functioning. Organization and memory. This is a test that asks children and adults actually, to memorize lists of words. What it shows is in the first trial, basically they do just as well as individuals without PKU, and also at the last trial for children under 11. Because remember, executive functions aren't solidified in anybody. After 11, most children and adults will categorize that list of 15 words to make it easier to remember. Individuals with PKU won't think to categorize it or can't keep it all in mind long enough to categorize it, and so their performance drops down, although their initial ability to memorize isn't that bad. Impulse control. This means that this test is a number of errors, and basically what it is that in most individuals, when they're given a test and supposed to, let's say, press a computer button whenever they see something on the screen, and if there's an error, there's a beep. Most people will slow down after that beep to make sure they don't make the errors again. People and children with PKU will just plow on right ahead. And I've heard many parents say their kid will just keep on making the same mistake over and over. It's not that sort of taking that little bit of time and inhibiting the first response. So what does executive functioning have to do with keeping a diet? Okay, what do you need to do, especially if you're a teen or adult, to keep your diet? You certainly have to plan. You have to remember how much fee you took for intake. Memory is an issue. Remembering to take the formula. Inhibiting that response of eating that 17th French fry or the 17th potato chip. Maintaining supplies, planning ahead, keeping an accurate sense in your mind that, okay, next month I'm going to have to order my supplies on such and such a date. Monitoring blood Phe and making adjustments. See, that's that shifting kind of thing. All that is really hard. So for an individual who's been off diet and is trying to get back on diet, I think it's almost impossible to do it alone. Without a lot of supports. And it's not a matter of willpower. It's not a I've known some clinics that say, I'm not going to allow my patient to try the Kuvan, or I'm not going to allow my patient to, try these low-protein foods if they can't even get their blood level down on their own. Well, they can't. And that's blaming the victim for something that really is probably not possible, given the cognitive limitations of PKU. So forget all that. Put in the supports. Don't put the head in the sand. And then see what happens. All right, and there's also behavioral and emotional outcomes. Dopamine is not only the prefrontal cortex executive functioning neurotransmitter, it's also considered the psychiatric neurotransmitter. And we don't know exactly how it is, but many of the antidepressants and anti-anxiety medications are dopaminergic. In other words, they try to up dopamine levels. And that's why we tend to see depression and anxiety in PKU. And often that's the first thing that gets better when the blood levels are lowered, is the depression and anxiety, even if functioning might not. And depressed mood is, in this one study, was the most significant with phobias and generalized anxiety. And I often say, I wish I had $1 for every patient that came in, adult patient that came in, that was on massive doses of anti-anxiety medication with no consideration of the PKU. Put them back on diet, and boom, it's gone. We did a study a number of years ago. I had 5 patients, adult patients, that were so phobic, agoraphobic, they couldn't leave their house. And since there were 5 of them, we thought, well, let's put them all back on diet and see what happens. Dramatic improvement on each of them. Some no longer needed the anti-anxiety medication. And again, I think the antidepressants and the anti-anxiety medications don't work very well unless the blood phenylalanine level is lowered. I don't know the biochemistry for why that might be. That hasn't been studied yet. Should be studied by people who know how to do those kinds of biochemical studies to check the response to those medications. But again, that is more in the blood phenylalanine level. Okay, and there's the agoraphobia. This was another study where we just looked at degree of agoraphobia in a bunch of women that were attending one of our camps compared to their blood level, and it was significantly correlated to the blood phenylalanine level. But there's a whole second hypothesis for why the problems in neurocognitive problems in PKU, and this is the myelin hypothesis. And you've probably heard about this, but just to make it really clear about what myelin is, okay? Think about myelin as the grease on a pole, okay? So in the brain, you have all these little poles or neurons that go from the back of the brain, remember where that sensory stuff comes, to the front of the brain, okay? Those are the pathways that these neurotransmitters have to go along. And they have a layer of fat on them. That's the myelin, okay? And it's like the grease. So if you have enough of that grease on the pole, then the sensory input can get to the front of the brain nice and quickly. But if the myelin is depleted, which happens in PKU when blood levels are high, everything slows down, okay? It just takes longer. It's like having sort of, sticky glue on those neurons rather than this grease pole. So that's just a way to think about it. And the hypothesis says that individuals with PKU have abnormal white matter. They may be related to increased myelin turnover, to elevated water content, which makes it look like that it's myelin reduction, disturbed myelin synthesis, meaning that it didn't get laid down right in the first place, and that may be why there's reduced speed of mental processing, which is the other big area that the studies show. And in a meta-analysis is when you take a lot of different studies and you put them together and look at certain aspects that all the studies looked at together so you can get a bigger population. So in 11 studies, they demonstrated deficits in lots of different domains. So again, the effect size, that means like if you think about an effect size, anything over let's say, getting closer to 1 or 0.8 is considered large, as just showing here what's small and large. But really, the biggest effect size of all the different studies was in processing speed. And I actually have come to the conclusion that a lot of what we think is attention deficit in PKU is actually a processing speed problem, an underlying processing speed. And visualize it this way. If there's a child, let's say a 10 or 11-year-old child who's in school, and their processing speed is slower, the teacher tells them some information. Let's say, okay, tomorrow I want you to do this assignment, and these are the 7 steps that you need to do. Well, they're still stuck on tomorrow I want you to do this assignment, and they're still trying to think, okay, tomorrow's Tuesday, I have soccer, what else? And already the teacher's on, number 3rd thing they have to do. Well, even if they're trying their hardest to catch up, by the time they get to the 3rd or 4th thing, they say, forget it, and they stop paying attention. So is that an attention deficit, or is that a slower processing speed? I believe it's a slower processing speed, and if we address that issue, which there's lots of ways to address that, like not doing everything verbally, but having some written instructions as well, you can fix that one. And attention may not be so much of a problem. And here we look at the percent of children that have school problems. And 50% have school problems compared to a control group. They more are likely to require special tutoring, and more are likely to repeat classes. Okay, here I have a caveat also. I don't believe in repeating classes because it's not a matter of development. You repeat class if, okay, they'll mature in 6 months and then they'll do it. If it's a matter of slower processing speed or some of these other executive functioning deficits of planning and organization, those aren't necessarily going to get better by just repeating the class and having everything taught the same way again. It's much better to, if they're going to repeat the class, put in different supports, put in remedial education. A lot of schools, it's a lot cheaper to just send the kid back to, 2nd grade again. But it makes much more sense to put in those educational supports, get the tutoring, and we'll talk about that in a minute. So the key second point is psychological assessment is important. It's getting harder and harder for me to get insurance companies to pay for our students to be evaluated. I used to have a letter that I could get them through and we could do it. It's getting harder and harder. So we've organized this Genetics and Metabolism Psych Network to try to get some information out there. If your child is being seen by a school psychologist, send them to this website because we're starting to put on lists of tests that should be used, reasons why, comments about executive functioning and all that. So it's an exciting group. We started with 11 of us who met. We also developed a list of 3 questionnaires that can be given by non-psychologists just to get a baseline on executive functioning and anxiety and depression in adults and behavior in children that can be given and scored by non-psychologists. So that's an important website to know about. So I'll briefly just say this is what we do in our clinic. Most clinics don't have this luxury to do it this often, but we really do assess the babies. And the reason for it is that if there's a score less than 85 on the Bailey test of infant development, which is not an IQ test, by the way, it means that there's probably something else going on, not just PKU. Most children with PKU do fine during the developmental years. They get their milestones at about the right time. Preschool, again, things are going usually pretty well. We do the Wechsler tests are the first IQ tests. IQ stabilizes around age 6. So you want to, around 4 or 5 we start at, we get a 6 or 7-year-old IQ, and that's really where it's probably going to be most of the time. Visual motor skills, behavior, and attention on that. School age, we get the real IQ test, which is the Wechsler Intelligence Scale for children. After that, we can do an abbreviated form that just takes 15 minutes. We start looking at achievement. Most of the children do okay in reading, that initial reading. It falls down in 4th grade when it's comprehension, but in the beginning it's fine. Arithmetic is harder, and we don't really have a good explanation for the visual, spatial, and fine motor deficits that we see in PKU. They don't really fit so well into the dopamine or the myelin hypothesis, so I don't really know what that's about. But that's another area we see, the visual motor, we see difficulties. And here's where we really do pay attention to processing speed. That's where we have to look at that. Adolescence and adulthood, again, pretty much the same kinds of issues, but here's where we really try to get into transition to adult care. And we talk more about this in our workshop, but here's where you really want to pay attention to independence, sense of identity, self-confidence. Children who are self-confident are less likely to cheat and engage in risky behaviors. So you want to pay attention to that. Also, we begin talking about maternal PKU. All right, the key point 3, there's strategies for managing the challenges in PKU. For infants and toddlers, if there's any sort of slowing down or any difference between motor and language, if language is delayed but motor is just fine, we'll get early intervention going there. It really works. Play therapy works for those 3-year-olds that won't take their formula. It's magic. You get the truck with the milk truck coming in, the special milk truck, and the doll with the, and the doll drinks the special milk, and they start drinking their milk again. Parent as educator, that works too for those early years. School age, okay, definitely get the remedial help. Chunking, that means just taking small bits of information at a time. If organization is a problem, don't throw too much at it. If a big problem broken down into little problems is much easier. Let the children dictate their thoughts to you, and then you can start to organize it. Never mind sorry teachers out there, but never mind the teacher who says, I don't want the parents helping you, I want to see what you can do. We know what you can do. You can get confused, and that's not good for self-esteem. It's not good for learning the material. So help your kid. Don't be shy about it, okay? Help them organize. Help them feel good about all those wonderful ideas, and then reframe it in an organized fashion, and then maybe have them dictate and you type it out if the writing is too laborious, okay? Remember, processing is slower. They're working 10 times harder than the next kid to get the homework done. So if they're objecting to doing homework, it's because it's too hard, okay? It's not because they're lazy. Don't blame the victim again. They may be more verbal learners than auditory learners. They may be verbal learners or they may be visual learners. You have to pay attention to that. Some individuals with PKU have a real hard time with maps and visual spatial. Others don't find that as a problem. Slow down the instructions. Ask for test modifications. Most individuals with PKU will do better with multiple choice because the ideas are out there and they don't have to kind of generate and organize them. Extended time works, taking more breaks. That can happen even for the SATs. I couldn't get it for the law school ones or the medical school applications, but for everything else, we've been able to do it, even for some of the graduate school. And then pay attention to stability of the blood phenylalanine level. Now, this is just a preliminary study, and a number of centers are looking at that. But we looked at 45 of our fairly well-controlled children. So this is true for well-controlled children. And just to summarize what this is trying to show is that children who had a lot of ups and downs in their blood phenylalanine level did less well than children whose blood phenylalanine level stayed fairly steady, even if their average blood phenylalanine level was a little higher. Okay? So it's not just the absolute level of metabolic control, it's how steady it can be. And the hope is that some of these new treatments can actually stabilize the blood phenylalanine level. So even if they're not lowering it, if they're stabilizing it, that's important too. For adolescents and young adults, I'm a strong believer in tutors, and that can help organize, help get the work done. Again, extended time. Choose classes carefully in college. Don't go, it'll be good for me to take this essay class where you have to read, 300 pages a night. Nuh-uh. That's going to not make you feel good. So choose classes carefully. Psychotherapy. Psychotherapy has in some people's mind is like, I got to tell all my deep, dark secrets and all that stuff, and I don't want to do that. Psychotherapy is really support. And teenagers actually end up really liking it if they can engage with the right person. And if they don't like it, the way I usually say it is go twice or 3 times. If you still don't like it, we'll find someone else. But give it a try. And if it clicks, it can be a lifelong benefit. And I'll even share a little personal. I have 4 wonderfully achieving, beautiful girls. They've all been in therapy. And now they're out of school, college, married. They go back and see their therapist just to tell them how they're doing. They form that nice connection. So it helps people, get through those rough spots. It's just another resource. You don't have to be mentally ill to use psychotherapy. It's really a support for the challenges that we all face. And then there's SAM. SAM is what we found was the best predictor of adherence to the diet in adults, and probably works for kids too. That means those who had social support for the diet, okay? It's not just a great family. It's a family or friends that say, I think you ought to be on this diet. It's positive attitudes, and it's not just, oh, it's not so bad. It's going to help you, and the person has to feel that it makes a difference in their life. They have to have that feeling. And third, and really important, is manageability. In the United States, that's often just having insurance. And for adults, I think it's also having an adult clinic, which does not exist except very rare situations. And I'm going to make one final plea for the adults with PKU in this room. You've got to do this. They won't listen to me. I can't get any money for this. I can't get any grants. I can't get it going. But with a lot of noise, I think that the adults are going to have to make this effort. And what's happening now to adults in the United States with PKU is a real shame, because I say it's almost like unconscionable, the lack of programs and services and resources and help. So if there's anything that a group like this can do, that's where a lot of effort ought to be put in. So, thank you. I'm glad you agree. So for another resource is there are lots of websites out there, but we've just been revamping our New England Consortium of Metabolic Programs. And there's a lot of good material on that now. There's the Transition to Adult Care Toolkit. There's a lot of videos and slides. There's talks given by Dr. Levy and other people on there. So there's a lot of stuff. There's maternal PKU things up there, and our website person is making us give her something every week. So my talk from today will probably be on there, and so things like that are going to be on there. That's another resource. And the takeaway messages are those 3 key points: that even treated individuals face challenges. Don't blame them. Assessment is the first step toward managing the challenges. Kind of like reading the Bible, we see where our failings are, so we know where to go. And the last is that strategies exist for nearly every situation. There is never nothing more to be done, because we have high hopes. Thank you.